Now let's transition to the arterial supply to the abdominal wall. This slide is demonstrating two arteries that run on the deep aspect of the rectus abdominis, and these are epigastric arteries. The first one is located right here, and you can see the rectus abdominis right along here. This is the superior epigastric artery. It is a branch of a thoracic artery called the internal thoracic that we see here along the lateral margin of the sternum. And then at this point, that internal thoracic branches into a musculophrenic, and then a more medial branch that is directed vertically into the abdominal region to help supply the rectus abdominis. Another deep epigastric artery is referred to as the inferior epigastric artery. We see it coursing upwards along the deep surface of the rectus abdominis. The source of the inferior epigastric artery is your external iliac artery that is labeled right at this particular point. And then the two epigastric arteries will anastomose within the substance of the rectus abdominis. We also have some additional arteries that supply the abdominal wall. Three of these are listed on the slide: the superficial circumflex iliac artery, the deep circumflex iliac artery, as well as the superficial epigastric. So let's take a moment to identify those particular vessels. Here we have our external iliac, and then on the deep aspect here, running along the ilium, is the deep circumflex iliac artery. The external iliac then will pass deep to the inguinal ligament, which we see here, and it'll enter the femoral triangle. And as it enters the femoral triangle, we will refer to this artery as the femoral artery. It will give rise to a superficial circumflex iliac that we see branching off at this point, and will run more superficially in this general vicinity. This branch that we see here is also issuing from the femoral artery. This is the superficial epigastric artery, and it will have a subcutaneous course on the anterior abdominal wall. Please bear in mind that this is not an exhaustive list of arteries that supply the abdominal wall. We have some others as well. For example, we would have 4 pairs of lumbar arteries that would issue from the aorta above here that would travel on the posterior abdominal wall and then start to follow the lateral aspects of the wall and start to anastomose with some of these other vessels. We also have an ilio-lumbar artery, which we see coursing up vertically along the sacrum. This is issuing from the internal iliac that we see here. And we certainly would have some other contributing blood vessels that would help supply the abdominal wall.